All right, welcome back. Whether we like it or not, or want to admit it, sweating naturally goes along with the summer heat, which is well on its way. So how can you control that annoying moisture? There are a lot of tips. Dr. Jim Knoetgen from Beautologie Medical Group joining us this morning with some of those tips. Good morning. Thanks for being with us so early this morning.
My pleasure.
So what are some natural things that we can do, and there are some even surgical options that we can look at here?
Yes, there are a lot. It sounds obvious, but the first thing is to avoid excessive sun exposure, especially in the summer months here in the Central Valley. Avoiding that extra sun exposure is really important.
And there are lots of things you can do for that, such as, you know, your wide brim hats, light clothing. I heard natural fabrics are also kind of a good option.
Exactly. Natural fabrics like your cotton as opposed to polyester, and loose, light clothing is very helpful.
And then staying hydrated, you know, taking in a lot of that water is actually going to help us here?
Exactly. Water is pretty much the only drink your body needs, so drinking a lot of water in the summer months is very helpful.
And along with that comes the other tip, things to avoid such as caffeine and alcohol and even sugar, right?
Exactly. A lot of caffeine and alcohol can cause sweating, as well as sugar, and in some people spicy foods, so they definitely want to keep those to a minimum in the summer. So avoid the energy drinks and drink more water.
And this is interesting. I think a lot of people probably use their antiperspirants more in the morning, but you're saying use them at night.
Exactly. If you put the antiperspirant on at night, it gives the skin all night long to absorb the antiperspirant. Then when you wake up in the morning and you go run out to school or work or go exercise, the skin can actually use the antiperspirant as opposed to washing it all away when you go to exercise or go to work.
And then do you use it again in the morning, or is it just a night?
Using it at night is usually enough for most people, but if that's not enough, then they can try in the morning as well, or just kind of experiment to see what works for them.
All right, and there are regular and clinical strengths there. And then also there's this option, a lot of people maybe have a medical condition because it is so excessive, and there are things that you guys can take care of in that case.
That's true. If these tips don't work for people and they try regular antiperspirants and they don't work, then it's really good to see your doctor or your dermatologist and get a prescription strength antiperspirant that's going to be stronger than the one you can get in the store.
And how can Botox help out here?
What Botox does is it blocks the nerves that stimulates the sweat glands to sweat. So if you use a little Botox in the armpits or the palms of the hands or even the soles of the feet, it really can cut down the amount of sweating that people have.
A lot of interesting uses we're seeing for Botox now between that and headaches, but also, and then surgery, that can also be an option.
Right, and that's going to be the last resort. That's just for the worst cases, but there's basically two different types of surgery people can have. Number one, they can actually surgically remove the sweat glands, like from the armpit. And
that sounds dangerous. Is that okay to do?
It's definitely a lot more invasive than the other tips we talked about, so you definitely want to try and exhaust all the other tips first, and if those don't work, then obviously talk to your doctor, talk to your plastic surgeon, and then kind of pursue that if necessary. And then the other kind of surgery would be actually dividing the nerves that stimulate the sweat glands to sweat, and that's called a sympathectomy or a thoracic sympathectomy, and that's done by a thoracic or a chest surgeon.
All right, Dr. Jim Knoetgen from Beautologie, thanks so much for being with us this morning. A lot of tips. Unfortunately, we may need them soon. Thanks so much. We'll be right back after the break.